We're at Unity Health Harris Medical Center in Newport and have a very special guest. We're going to talk about an array of things right here, but let me introduce to you Sherry Pierce. And Sherry, your actual job title, Community Education Coordinator, and what we talked about prior to this, it's a lot more than education being a coordinator.
Yeah.
You have a lot of things going on here at Harris Hospital around. Tell us a little bit about you. Tell us where you're from and where you grew up, and tell us a little bit about it.
Well, I grew up in Cherry Valley. I'm a cross county girl, and my dad was a farmer, and I ended up going to college at Arkansas State University.
Right, yeah.
And got a degree in social work, and seems like every job that I've gotten had dealt with the elderly, and I ended up doing marketing. I mean, so I didn't really do any type of therapy or anything like that, but I love to market, and I love to help people and refer them and link them to the resources that they need.
Okay. All right, in marketing, and of course, we're going to talk a little bit about senior care here, and of course, everybody knows what monetary investment that we have made here for the senior care. Kind of give us some ins and outs of senior care and, you know, what you do there and your marketing, and we'll get into a few other things that you do also.
Well, here at Unity Health Harris Medical Center, we have a senior care facility. It is for adults ages 55 and up, and it's an acute care psychiatric. We have Dr. Travinsky is our psychiatrist there, and Dr. Green, of course, is our medical director. Chalisa George is our program director. And we have 12 beds. We recently remodeled those, and everything's brand new back there. And we help people remain in the home in the least restrictive environment if they have some type of behavioral problem like Alzheimer's or dementia. We try to put them on medications and make them manageable to go back to the least restrictive setting. So we get referrals from all over the Northeast Arkansas, and that's what I do is I primarily go and educate the community here about the services that we provide.
So, and you're talking about, who do you go see? Who are the people that you target? Civic groups or just?
Well, I'd love to speak at any civic group about things, but I target nursing homes, physician offices, senior facilities. I target, we get referrals from hospitals, emergency room. Sometimes people with Alzheimer's, dementia, their status changes and they're wondering, or they can't keep them at home, or sometimes a silver alert's even issued. And that's a big red flag that they need to be assessed and monitored. And that's something that we can do, and we can educate them and let them know what is the best environment for them to be in. And we may recommend that they might need to go to a higher level of care, such as a nursing facility. Or assisted living. I get lots of referrals from our assisted living because they want them to remain there, and so they put them on medications to make them more stable so they can remain there. So, and we don't want to drug them. We want them to have the best quality of life that they can have. So.
And obviously a specialized group of people that you're targeting here, because it's a specialized service that we are providing here, no doubt about that.
And that's why I became involved here. I was actually a corporate marketer for a group of nursing homes, and I sent all my residents to this facility and just fell in love and had been using them for the past 7 or 8 years, and a job opening became available, and I said, well, hey, I would love to market that program because I believe in it, because it is a good program.
Now, you have a trip that's coming up that we want to talk about. Tell us a little bit about this big trip you got.
I'm very excited. Every year, this is my 5th year, I am the ambassador for the Alzheimer's Association to Congressman Rick Crawford. And I meet with him before I go to Washington, D.C., and I meet with him during the trip, and then I meet with him afterwards. And what we do is we try to advocate for legislation to pass funding and research for Alzheimer's and dementia-related disorders, because Alzheimer's dementia is the most expensive disease in the nation and the world today, and some people do not realize that. And if they don't do something now, the taxpayers will be paying for it later because of the baby boomers. They found treatment for, the cancer and, heart conditions, but they haven't really found anything for the brain as of yet. And I've actually met with the doctors there, and they feel like a cure is could be maybe in our lifetime or in our children's lifetime.
Right.
And so 1,200 advocates flood Congress on this one particular day, and we just hit them up and ask them to vote for these things.
Sure.
And we encourage the community and the constituents in this area to write to their congressman if they, to pass legislation for Alzheimer's research and funding.
All right, now you marked a couple of dates right here that we
Yes.
wanted to talk about. Let's talk about what happens on these dates each month.
Okay. Well, here at Unity Health Harris Medical Center, we have every first Friday at noon, we have a Jackson County Senior Networking meeting. And what that involves, anybody that's involved with elderly care services or seniors, they come and we just kind of network. We have the lunch that we provide here at the hospital. And we also have a featured speaker. So everyone gets to do their little infomercial. And then we talk about what's going on in the community for our seniors. And we usually have a large crowd, but we encourage people, to come. If you have an agency that, deals with senior citizens, please feel free to come and join us. It's going to be this Friday, March 3rd, I believe, at noon. And it's every first Friday of the month. And I facilitate that group. We have a lot of fun. We had the survival flight last month. The helicopters came,
Sure.
we had a big time. And a new thing that we have started, or I have started, is an Alzheimer's support group for caregivers where the caregivers have a chance to come and vent. It's a true support group.
Sure.
It's a confidential group, and we encourage people, if you would like to learn more about Alzheimer's, or if you have a loved one with dementia, Alzheimer's, please come. It is the second Friday at 10 o'clock in the morning, and you are more than happy to contact me or to contact our senior care unit to find out, more about that if you would like that.
Second Friday?
It's the second Friday.
Of every month?
Of every month.
Of every
yes,
month. Okay,
yes,
good deal.
Yes,
So
yeah.
things going on. What else do we need to talk about today?
Well, let me think. I wrote down some things, but now I'm just really excited to work here at this hospital. I'm glad to be part of this community. I used to work with juvenile delinquents back when Jim Bishop and
Yes.
Larry Daniels and that crew.
Yeah.
And so I've always loved the Newport area. I have family from this area. My granddaughter, my daughter is affiliated with some families here
Sure.
in the Newport area, and I love the senior care. I believe in it. The doctors and the nurses there provide quality care. They will meet with you, and they do staff meetings with the families once a week to let them know how they're doing. And Dr. Travinsky comes and sees the patients every day. And every day. He misses one weekend out of the month, but
Right.
he's there every day seeing them, and he monitors them. And we just want you to know that you have somewhere to go if you're concerned about a loved one. There's a change in their status. They've gotten aggressive or combative, and they may not have even been diagnosed with anything. You're welcome to just send them to the emergency room, and we'll be more than happy to assess them. Sure. So I'm just really excited and honored to be working here.
I bet you are.
Yeah,
I
and
bet
just
you.
love it.
Well, I know this, having
Yeah.
this week before you got on here, you do a
Yeah.
lot of things, and
Yeah.
and you got something that's dear to your heart. I know you're doing a great job, and I've heard good things about you, and obviously the senior care program here. I appreciate you taking
All right,
time to
well,
visit
thank
with
you.
us.
Well, thank
Sherry
you.
Pearson, and you
Yeah.
talk about just some type of educator. You're a lot more than the educator.
Yeah. Well, thank you. Yeah,
you
thank
do.
you.
You have
And-
quite a responsibility
Yeah,
here at Harris
yeah.
Medical Center.
Yeah. Thank you so much for having me. Looking forward to it.
Thank you very much. Let's
Okay.
continue on with more of the Business Spotlight.